Hi, my name's Jo, and today our training session is about BSLs and the reason why we take them. I'll just go through some housekeeping rules. If you need to use the toilets are out here on our left. And if you're having trouble understanding the lesson, after the lesson you can actually come and see me and we'll have a one-on-one and we'll make another time to do that. Okay. At the end of this training session, all participants will be competent in performing a BSL. So I'll just hand out the sign-on sheet for you to sign. Today I have Liana, I have Anne and I have Dave, who's my volunteer. So I'll just get just to sign your name on this attendance sheet. Leanne can do it later because she's actually my lady that's taking the bill. Okay, so I'm going to give you a form, and it's our assessment form on what the procedures are that when we're taking a blood sugar level. So, okay, just do this here at the end there. And we might just go through that procedure. So we collect all the appropriate equipment that we will need. So we've got the sharp container, we've got the blood sugar level machine, which, has anyone seen one of those?
No.
So
what's BSL actually stand for?
Blood sugar level.
Okay.
So that's the machine.
Yep.
And later on we'll be using it. And I'll do a demonstration. And then you can do a demonstration. You think about that. Okay, so, and we also have gloves. And does anyone know why we need the gloves?
Infection control.
That's right. So we always use the gloves, wash our hands and put our gloves on, because if I take Dave's blood sugar level and it's body fluid and I haven't got gloves on and I've got a cut on my finger, if he's got some disease, I could pick it up, or vice versa. I could give him something.
Yep.
Yeah. So that's the reason why we use our gloves. So then we collect the appropriate equipment, prepare the resident, and we explain what we're going to actually do to the resident so that they know what we're doing. Ensure the resident dignity at all time and make sure that they're comfortable. So if I was to do Mary's, one of the residents' blood sugar level, I would bring her back to her room. I would close the door so that no one knows that we're actually taking her blood sugar level. Okay. Ensure that the resident safety is maintained throughout the procedure. Use appropriate infection control procedures, which is your gloves, your sharps container, you have your blood sugar machine, and you always dispose of the little needle straight after you've taken them, so that no one else can get pricked. So then you always follow the Catholic health procedure and practices. You dispose of the equipment appropriately, like I've explained, into the needle into the sharps container. Ensure the resident is comfortable after the procedure, because they could be feeling a little bit not well. We report any reading. We ring the RN straight away and we tell them whether it's low, high or normal. Because if it's high, well then the RN actually have to follow doctor's orders and give them the medication.
So what's normal and what's high?
Well, normal is between 5 and 8. That's what we say. But yours could run on 10 and that could be normal for you. It depends on the person actually. And the best time to take the blood sugar level is 15 minutes before each meal. And documentation. So the RN normally documents it in the medication book, and it's also put in the notes. But we can also put it in the notes that, you know, you attended the blood sugar level and what it was.
Jo, is there any other forms, like an observation form or something we should put it on?
Yes, there is, in the observation book.
We don't find that.
in the nurse's station.
So do you put it on that all the time, or do you put it on a blood sugar level 1?
On the blood sugar level 1.
Okay.
That's it. So if you have a look at that handout that I gave you, and it's got questions there. So, state when you require to conduct the blood sugar level. When would you think you have to conduct it?
Like you said, 15 minutes before each meal.
Mm-hmm. And it's not for every resident. It's only for residents that are diabetics.
So how do we know they are diabetics? Is there any...
Normally when they come in, it's on their...
So it's nowhere else that I know?
Normally your RM would tell you.
Is it on their diet directives? Okay.
Do we put it on places, like their care plans or whatever?
Their care plans. You can, definitely, on their care plans.
Okay.
Yeah. Why is it important not to prick the middle of the finger? Why?
Because it might bleed a lot, I don't know.
Not the middle of the finger, it's the top of the finger actually.
Might hurt.
And I've always been taught, in here it says to prick the middle of the finger, but I've always been taught to prick it on the side. Because if they play the piano, play the guitar, can you imagine?
It's very nervy, isn't it?
It's nerves, 2 nerves at the end of your finger. So you don't actually take the blood sugar level. State 2 important abnormal readings or findings to report and document following the procedure.
If it was too high or too low, I suppose, would it?
Yeah. If the resident was confused, clammy, anything that's abnormal.
What do you mean abnormal?
Well,
when you're doing it or
person.
before you've done it or?
Before or after,
Okay.
because they can be confused. So
What's that mean?
that means that their blood sugar level could be too low.
And if it's low, what do you have to do there?
Well, we normally give them jelly bean or something to increase their blood sugar level because their body's not producing enough.
So say mine was really low and you give me jelly beans, do you wait a certain time before you redo it?
Yeah,
Or
we
you
normally
just
wait.
do it given to me, I eat
No,
them and
you
straight
go
away
back
you do it?
and after you've had your food, we will wait, and then we go back and take it probably within half an hour. So you always make sure that you wash the residents' hands because they might have just had morning tea, and that will give you a wrong reading.
So what you mean if say I had a cake or something and the icing or something was
something's
on
on
it,
your
that'd
finger?
really make it go haywire, would it?
Yes, it would. Yeah. Also, you prick the finger and you draw up the blood, wipe the first lot of blood off, and then squeeze it again and take the second lot. That gives you a more correct reading than what it does the first time.
Does it hurt them when you do it though?
No, it shouldn't. Well, I hope it doesn't.
I was just wondering.
Yeah, well, no, it shouldn't. So, now, are we going to have a little practice?
Can I just ask a question?
Mhm.
What happens if you had a resident who had dementia, who was a bad diabetic, and they don't like you taking it? What would you do?
Probably try and take their mind off it, even take another staff member with you, so that person can actually be talking to the resident while you're doing it.
And should you have anyone with you, or should you just do it by yourself?
Normally we do it by ourselves. Normally, we explain the procedure to the resident. As soon as we do it, we ring the RN and tell them the result, and then we go to the RN and help them get the medication that's required.
Okay.
Yeah. And we always check that. Always to check it.
Is that like tablets as well?
The injections.
So when do you have an injection?
As soon as you've taken the blood sugar level, before the...
But didn't you say
meals.
before you give them a lot of lollies, did you? If it's...
No, you wouldn't give them the injection then. You'd give them the lollies, see how it goes, and then...
So why are we giving them an injection? Sorry.
To bring the blood sugar level down.
So if it was really high, you don't give them food.
No.
You have to give
You
them
have
an
to give them
injection
the
to make it
injection
come
to
down.
stabilise it.
So what happens if you didn't give that injection? What would happen?
Well, they'd probably have a hypo on. Yeah. So it wouldn't be real good. Because it's pretty serious. A lot of people don't think it is, but it is.
And do they have to follow a really strict diet, or is it just not having a cake here or there, or can they still eat and drink what they want to?
It's actually controlled by diet, so yes, they should watch what they're eating, especially if they're a bad diabetic.
And does our kitchen automatically do that,
They've
or
got-
do you have to, you know?
Diet directive is put into the kitchen when they first come in, so they actually know that that person's a diet, has bad blood sugar levels. And then, yeah, so the kitchen sort of control
they know,
it as
and
well.
so they give you
But the nurses
appropriate
have to
food.
control it fairly well because we give out the morning teas, the afternoon
What
tea.
would you do though if you had someone that wouldn't follow that diet, and they had got food in their room and was eating it, and
Report it to RN and they can deal with it.
then they'd have to talk to the family or
Yes.
something with them.
Yeah, not to bring it in. But sometimes that doesn't work either. So, makes it a bit harder. So, we might perform a blood sugar level test now on Dave. So, what's the first thing?
Put your gloves on.
Wash your hands.
Dave. You was listening. And you failed. So, I'm going to wash my hands in here. Normally, I'd wash them out in the sink. Okay. And there's no towels in here. So I'm going to use the face wash. Now the gloves are always kept either near the sink or you can actually find gloves in the residents' rooms. So I'll just put my little gloves on. Look out, Dave. You getting nervous?
No.
Oh, we've got it. Tootie yell.
Scream as she does it.
Does Dave get the practice on you, Joe?
Probably. I think that's only fair. Now with the machines, you always have to make sure that the code on this machine matches the code on the sticks that you're going to use or it won't work. See? And on this, it's just up there.
Alright.
Yep, see that?
So what happens if it was a wrong code? It wouldn't work.
It wouldn't work.
Oh,
Wouldn't work at all. Okay, so I'll ask Dave to wash his hands.
Is there another way you can do it, Joe? Like if they
I can
can't
use a
get to the
face
sink?
washer and wash their hands.
Can you use alcohol swabs on them to wipe their
Well, no,
fingers
I
or
don't.
not? Can you use that?
No.
Oh. But wouldn't the soap do something? Oh no.
Cleans the germs off your hands.
It's neutral, isn't it, Joe?
Yeah, it's proper. Not thin soap.
To go.
Oh. Okay, now Dave. You've washed your hands. Do you feel comfortable?
Yep.
Are you nervous?
No.
Good. He's petrified. Now I'm just going to prick your finger. Okay. Now I'm going to squeeze. Come on, Dave.
Here's
A
the
little
bit
bit.
of blood.
Now you'll wipe that one away. Okay. And then squeeze more up. So with that, I've used straight into the sharps. Pop it there. Got my machine.
Do you need a lot of blood, Joe?
No, you don't.
I was going to say he doesn't.
These actually draw it up. So it doesn't have to have a lot of blood there for Dave's to work.
So what did you do then?
I put the little stick in there.
Is there a right or a wrong way to put
Yes,
it
you'll
in?
see the little arrow down here.
Yeah.
So it has to go in that way
And face up.
and face up. And now it's telling me to draw up the blood.
So how do you draw it up?